Welcome to Multnomah County's HIPAA Advanced Training. This training supplements county, department, and division policies and procedures and will provide you with important information about your responsibilities. There are multiple modules in this training, and this is the first one. This module should take about 8 minutes to complete. When you are finished with this module, you must watch the remaining modules in order to complete the entire training. Before we get started, you should know that the county offers in-person trainings from time to time on topics such as business associates, de-identification of PHI, safeguarding personal information, disclosures of PHI to law enforcement, and 42 CFR Part 2. Watch for and register for courses or email privacy@multco.us for specific training requests. Be sure to also check out guidance and the list of department privacy contacts available on Multco Commons. Your department privacy contact is available to assist and answer questions not already addressed in policies and procedures. Now, let's get started on the training. What is HIPAA? HIPAA stands for the Federal Health Insurance Portability and Accountability Act and governs the use, disclosure, and safeguarding of protected health information, or PHI. HIPAA also outlines individual privacy rights that you are expected to understand in order to help individuals exercise their rights. HIPAA balances safeguarding PHI with reasonable use and disclosure to provide high-quality health services. HIPAA applies to some but not all parts of the county as a hybrid covered entity. For example, the health department provides treatment to individuals and is subject to HIPAA, but the county also collects property taxes from individuals, which are not subject to HIPAA. Areas of the county directly subject to HIPAA are called covered components, and you are completing this training because you are part of a covered component, provide internal support services to the covered components, or handle business associate services to another covered entity such as the Oregon Health Authority. Let's talk about protected health information. Safeguarding PHI increases trust with individuals we serve. Safeguarding PHI of individuals is especially important for those with lower incomes, seniors, and persons with disabilities who may be disproportionately impacted by information and identity theft should it occur. A breach of PHI can cause stress and financial hardship to individuals. Additionally, a breach of PHI can cause reputational and financial harm to the county. The term PHI can be misleading. PHI includes information about an individual that can be used to identify the individual. PHI includes demographic information such as name and date of birth. Medical diagnosis does not have to be included. PHI is protected in paper documents, spoken words, and electronic transmissions. PHI is information gathered for determining eligibility for a health plan, like Medicaid, and is information used for direct healthcare treatment or services, such as a physician's examination or a laboratory blood test. You must handle PHI securely and use and disclose it only for permissible purposes or with authorization by the individual. A use means accessing PHI for your work. A disclosure means sharing or allowing access to the PHI to another person or third party. Now let's talk about disclosing PHI. The purpose of a use or disclosure of PHI drives the permissibility, and it is your responsibility to understand the rules and ask in situations where you need help. Let's discuss some of the permissible purposes for using and disclosing PHI. HIPAA's general rule is that PHI can be used for the purpose of treatment, payment, and healthcare operations without an individual's authorization unless an exception applies. Let's examine a scenario to demonstrate each purpose. Sam receives primary care treatment services from the health department's primary care clinic. Sam's physician then refers Sam to Nurse Betty at Community Hospital, along with Sam's PHI for the purpose of treatment. This is a permissible disclosure for treatment because Nurse Betty is a healthcare provider. On the other hand, the disclosure cannot be made to law enforcement or a health plan because neither provides treatment. Treatment also does not include social services or coordination of services that support activities of daily living or housing support services. SAM also is insured by the Oregon Health Plan or Medicaid. The health department can bill the Oregon Health Plan or Medicaid for SAM's primary care treatment services for the purpose of payment, and the health plan could receive and use SAM's medical records to determine medical necessity of the services. The health department and other supporting areas could use SAM's PHI for the purpose of auditing, quality improvement, or to resolve complaints. These purposes, as well as other administrative, financial, and legal activities, are considered healthcare operations. There are some very important exceptions to this general rule. Let's talk about authorizations. If PHI is subject to more stringent requirements, you must obtain an individual's authorization or find other authority for the disclosure of PHI, even for the purpose of treatment. For example, 42 CFR Part 2 is a federal regulation that protects substance use disorder records. There are also special rules for psychotherapy notes and genetic testing records. Disclosures of PHI are also permitted when required by law. We will talk more about authorizations in the next module. Now we're going to talk about privacy practices. One helpful way to think about HIPAA is to view it as a set of rights we all share and guidelines for ensuring those rights are protected. Individuals are notified about how PHI can be used or disclosed through the Notice of Privacy Practices. This notice must be made available to individuals receiving services from covered components. Individuals receiving direct treatment services must also sign an acknowledgement that they have received the notice, which is kept in the individual's file. The notice must be provided to any individual upon request, is posted on our public website, and posted in covered component offices for quick access. The notice also discusses the individual's privacy rights under HIPAA. All individuals have a right to receive a copy of their medical records or view them, request changes to a medical record, request a list of accountable disclosures, complain about our privacy practices, request restrictions on the use or disclosure of PHI, and receive communications in a specific way. HIPAA and state law require a timely response to any request, so be sure to follow your department's procedure for routing these requests to the right place. Now we'll talk about business associates. A business associate is a third party that creates, receives, maintains, or transmits PHI to perform services to or on behalf of another covered entity. In many cases, a covered component has outsourced services to data storage vendors, language translation providers, or independent contractors that require the use or disclosure of PHI. Business associates of the county must have a written agreement in place with the county. There is no dollar minimum for the services provided by the third party. This written agreement is called a Business Associate Agreement, or BAA. Your department contracts team is available to provide more information or review County Administrative Procedure HIPAA-5 for additional details. You have reached the end of the first module of the HIPAA Advanced Training. Please continue to the remaining modules in this training.